Hello, guys. So just give us a few minutes. So we understand network issues are messing up a bit. Just give us a few minutes to sort that out.
Yeah, so while Audio is working on the slides, I can give a little bit more
Sorry.
background on RHA. Audio, are you ready? All right, we'll give her a minute. So RHA, Reinventing Healthcare in Africa, is really an initiative to help increase access to health. Sure. Audio, take your time while I continue giving a background, and then we'll get more into the slides. And so the whole idea is to help doctors practice more efficiency at top of license, and also give consumers avenues to connect with doctors more easily. And of course, since the pandemic, what we found was that there was an increased uptake in telemedicine and also in digital health. And so ourselves as providers and also people who have families who have had challenges in healthcare decided to come up with a solution. How can we reinvent the healthcare landscape in Africa? And starting from Nigeria, we're looking to make some strides in helping doctors. And so telemedicine has been around for so many years. Many of you probably already practice telemedicine, but the problem was doctors were not able to take ownership of their telemedicine practices. They're not able to take ownership of, their ability to make money from telehealth. And so that's why we decided to create this webinar as an opportunity to educate, engage, and also to enlighten doctors on how to start their own telehealth practices. So we're going to make this quite interactive. With a show of hands, if you've ever done telehealth before, just use your mouse to do an indication. If you've ever done a telehealth consult before, do you mind raising your hand and sharing? Awesome. So I see a few people's hands are raised. I myself, I have done telehealth. And so, yeah. And so some of us already know what telehealth is and what, it entails. Now, for those of you who have done telehealth before, if you don't mind adding in the chat, if you've had challenges before with telehealth, can you put your comments in the chat saying, hey, this or this challenge I had? For example, have you had communication issues when you have telehealth consults? Did you feel like you couldn't examine the patient, and so there were limitations in the way you were able to deliver care? Have you ever had maybe a time when a patient came on a telehealth consult and the patient couldn't communicate their problems to you and you couldn't really make a diagnosis? Or maybe the telehealth platform you were using wasn't sophisticated enough. Maybe they had technical issues, and so maybe the calls were dropping, things like that. So if you've ever had an issue using telehealth, please feel free to drop in the chat while the conversation is going. And so the reason why I brought that up is because one of the reasons why doctors in Nigeria are finding it hard to adopt telehealth is because there are challenges in the utilization. And then also the fact that traditionally, medicine is done you can't really do a medical consult unless you're touching and feeling the patient. And so how are we able to combat those issues? So there are things like remote patient monitoring. If you've ever heard about remote patient monitoring and technology devices for remote patient monitoring, please drop in the chat by saying yes or raising your hand. The reason why all of this is coming up is because we're trying to prime you and educate you on how you can make money, from telehealth. And so, Odun, are you ready to continue, or you want me to keep engaging while you, okay, let me see if she's,
Hi,
okay, perfect. Okay, so she's ready, perfect. So when it's my turn to speak, then I'll continue, but I'll let Odun take it over now. Go on, Odun.
Yeah, thank you so much. Once again, apologies for the break and transmission. network. So, okay. So thank you, Dr. Kika, for walking us through the RHA story, the importance of telemedicine and telehealth as a whole. So moving forward. Okay, so revolutionizing care and building tomorrow. Like Dr. Kika mentioned, we're trying to revolutionize healthcare through tech in Africa. And this is the RHA story. So role of RHA as an initiative and as a platform is that we're here to, collaborate, exchange ideas, showcase success stories in helping to move and propel healthcare delivery. So this, we're trained back to when we had our Digital Health Transformation Summit in 2023. Do we have anyone that happened to join our Digital Health Transformation Summit back in November 2023? Please show of hands if you did join. Okay. Okay, great. I can see hands. Stakeholders, key stakeholders in healthcare. We got to learn from the commission strategies because, again, with healthcare, we are interested in letting people know that not only can you improve patient care and quality of care, you could also increase your practice to be there for your patients. Okay. So our slides it's good offline, the call, but when I joined, I just noticed that the slides don't move. They aren't moving. So. Okay.
Okay, so Odo, if you share your slides, I'll continue the conversation. Can you put the slides up?
Yes, let me put the slides
Put the slides up and I'll continue the conversation while we're working on your internet stability. Awesome. So back in 2023, just last year, November, we had the RHA Reinventing Healthcare in Africa event, and it was called the Digital Health Summit. For those of you who were not in that event, we had several stakeholders in healthcare join us for that event. We had, I believe, the Commissioner of Health, Lagos State, Commissioner for Wealth and Employment in Lagos State as well. We had the Lagos State Employment Trust Fund. We had a Nigerian Medical Association president, Dr. Tosinlowo Jebutu. We also had, the CEO of Olusegun Obasanjo Foundation joined us, and so many others like that. We also had insurance brokers. And the reason why we brought all of these people together were to really identify what the challenges were in healthcare. And one of the key things that we realized or noticed was not only was there a problem of accessibility or infrastructure in the healthcare in Nigeria, but also there was a problem of adoption in telemedicine from providers. So when you have problems like that, the first thing you would do is, what is the root cause of why people are not adopting telemedicine? Potentially, you have adopted telemedicine through maybe an insurance payer, or maybe a telemedicine platform or a health system. But when you critically look at it, you're a very few set of people who have done telemedicine compared to very vast majority of doctors. And so one of the things that we were, that was brought to our attention was the technology. The technology behind telemedicine is still pretty much not so, how would I put it, advanced, especially in Nigeria or in Africa, and mostly because of issues around connectivity. How do you connect people through telehealth? And so questions were, okay, what already exists in Nigeria? Do we have low connectivity devices that people can use to remotely monitor patients? Also, how do you reduce bandwidth on platforms like, Zoom, for example, is not a product created in Nigeria or for Nigerians. And that's why it's hard when you're in a Zoom call to have low bandwidth and still be able to connect. And so solutions need to be brought to life that allows doctors do telemedicine without much friction. How can you do telemedicine through WhatsApp? Right now, if you're not aware, WhatsApp has communities that they've incorporated on the platform that allows doctors to pretty much build communities around their patients. There is something we currently do in the United States that I know is common in the UK or in Dubai or places like Australia, called group visits or shared medical appointments. Is anyone on the call familiar with shared medical appointments or group visits, if you've heard anything of sort? If you have, please raise your hand or drop a yes in the chat. And there's a reason why we're asking these questions, because we want to use it to help you really understand how you can create your own telemedicine platform. On top of that, how you can make money on a global landscape, and at the same time, be able to have a good work-life balance and enjoy doing telemedicine without having to quit whatever you currently do, by the way. So if you've heard about shared medical appointments, I'd love to see your hand raised. And so right now, I'm going to pass it on to Anita, and she's going to, address this question we have on the screen.
All right, thank you, Dr. Kike. Thank you, everybody. If you can hear me, just let me see your hands up, so I'm sure that everybody can hear me. If everybody can hear me clearly, can I just see hands so that I know that? All right, very good. All right, so just like we're asking, like in the past 5 years, what pivotal historical event or impact do you believe has significantly contributed to the rise of medicine and digital health? Hi, Jemima, I can see your message. Hi. So you can just put it in the chat, like put your answers in the chat. What events, in the last 5 years, what do you think has driven the growth of telemedicine and digital health generally, globally? What events, what happening do we think has driven the impact or the rise of telemedicine and digital health? All right, so let me just check the chat. Okay, Jemima, I've seen your message. Any other person? What do you think has driven the growth of telemedicine generally and digital health? So this is going to be interactive, so I need, okay, I'm seeing answers now. Thank you. Thank you. All right, very good, very good. I'm seeing answers. Great. Great, and so we're all correct.
Hello, good
yes,
afternoon.
Hi, good afternoon. Yeah, so I'm seeing this in the chat. I can hear you. All right. So I am seeing all the messages in the chat, and they are all correct. COVID-19 was one of the most pivotal things for the growth of digital health globally. Everybody had to adapt. I remember that time healthcare in Nigeria were all all thrown into ways, even schools, everything had to, it drove the rise of technology across board. Both healthcare, school, everything had to, everybody had to make adjustments. It's pushed remote work generally, and then people started thinking of other ways things could be done, other ways things could be done better with technology. And so for healthcare was not left out. Healthcare also saw tremendous change with COVID-19 because we had to adapt. And that's where one of the reasons, but telehealth has been existing way before then. That's the funny thing. Telehealth has always been existing, but just adoption was always an issue. And so with COVID forced adoption, and right now, everybody has had to adjust to it. And in Africa, we are looking at a situation where we are lagging behind in adoption. And so we want to talk about it today so that we can make strides to catching up with the rest of the world. Because Africa is lacking behind in adoption of some of these solutions that open room for tremendous growth. Now, in Africa, we've always had the problem of accessibility and affordability of healthcare, which is one of the problems that RHA is trying to solve. That has been a problem in healthcare from time immemorial. For as long as I can remember, global health and public health challenge, one of the biggest public health challenges in Africa has always been affordability and equity. And so telehealth poses a big solution to these problems. Now, we are just going to talk about some of the benefits for patients and then some of the benefits for healthcare providers. We're going to handle it from both sides. So we're going to talk about the modalities first for telehealth. Dr. Kike was talking earlier, and she was talking about video consultation that enables patients to connect with healthcare providers in real time, facilitating face-to-face interaction. So we are having this meeting on Zoom, for example. Those are the things that have made telehealth possible. This Zoom call, we have WhatsApp, we have FaceTime. So many platforms are rising up that are handling video consultations and have made telehealth possible. We have remote monitoring, like she was talking about earlier too, where you can track vital signs and health data and you can report it real time. And so those things have actually made adoption quite possible. And so in recent years, we witnessed a huge revolution that has driven advancement in digital health. Now, what is the relevance? What is the benefit? The first benefit we'll talk about is bridging the gap. The first benefit we'll talk about is bridging the gap between patients and doctors. We've spoken about it, about the problem of accessibility. And so telehealth is one of the biggest solutions that we can offer to the accessibility of healthcare in Africa. We can reach underserved areas, we can reach remote areas where doctors are not situated. We've always had the problem of rural-urban migration of healthcare professionals, and that has been one of the big problems in global health. Right from when we were in school, when you ask a question and you say, oh, problem of public health, there's a constant problem that I always knew to write, and that was rural-urban migration, even right from primary school and secondary school, because you already understand that there are not enough healthcare professionals in remote areas because everybody wants to be situated in the urban centers. Now it's no longer a problem. It means we can serve people in remote areas, we can serve people in rural centers while we are still living in urban areas. So we are finding a solution that connects patients with doctors, even without them having to be on ground, right? And then there's the convenience issue. Another benefit is enhancing patient experience with convenience issue. Now, imagine, of course, we understand that there's some conditions that we always will always have to solve in-person consultations. But for convenience sake, there are cases, there are primary cases of video conferencing with the flexibility of telehealth that we would not need in-person consultations for. And so telehealth is opening up such a big world. Telehealth is opening up health professionals to a big world I'm still talking about the benefits to patients here, but even while I'm talking about it, I'm already diving into what's exposing the healthcare professionals to, right? And then for patients to telehealth is putting healthcare in their hands. It's putting these healthcare decisions right in their hands. It means that healthcare professionals, patients rather, are able to participate in the decision-making process more than ever before now. Because right now, they can chat with their doctor when they have issues. They can speak to their doctor. They can complain. They can make certain changes. They have more control, more power. We are breaking down the barrier sharing, right? So we are breaking down the barrier to healthcare accessibility. We are breaking down the barrier to affordability of healthcare. We are streamlining healthcare delivery. We are making it easy for people to access healthcare. Sorry that our network is a bit shaky, but I believe everybody can still hear me. If you're having any issues with hearing me at any point, please just put it in the chat so that we would make adjustments. Thank you all so much. If you're having any issues at all with hearing me, please just put it in the chat so that we can make the necessary adjustments. All right. So we're still talking about the relevance of healthcare in modern health. We are still talking about the relevance of telehealth in modern healthcare. That's what we are discussing. We're still talking about it. That's what we're still handling. All right. And then one of the biggest roles that healthcare can do is foster continuity of care and support holistic patient management. Right. So across through telehealth platforms, healthcare providers can seamlessly coordinate care transitions, share patient information, and collaborate with members of the care team. Right. So we with telehealth, we offer a wide range of benefits. We have the potential to transform the healthcare landscape and improve the lives of millions of patients worldwide. By empowering patients and improving this access to healthcare, we can enhance our efficiency, we can foster continuity of care, we can support holistic patient management with telehealth. And so these are some of the benefits that healthcare affords patients. Now let's talk about doctors before we move to the limitations and challenges of telehealth. Some of the benefits that telehealth would offer doctors is that your impact increases. Now, we've been talking about access to healthcare, accessibility issues, and not being able to make impact. We know that for a lot of healthcare professionals, you want to actually serve these rural areas. You want to actually increase your reach and increase your patient load, but you do not have a way to do it because you can't move because you also like the comfort of life, and maybe for some reason you have to stay in a particular area. Right now we are at a very beautiful place where we can deliver healthcare to anywhere we want to, like right from where you are. For a healthcare professional, that's opening so many doors for you. It means that you can be sitting in Lagos and having a conversation with a patient in Kenya and offering solution with a patient in Kenya. And guess what? It's not just increasing impact, it's increasing your income, right? So we have to take advantage of these times to increase both impact and income. Now, for a lot of time, especially in Nigeria, where I'm situated, we've had a lot of doctors complain of remuneration, right? Poor remuneration. And that is what is driving some of the migration issues that we've been having here in Nigeria, where I'm from, right? But we've been having that issue of migration of doctors because of income problem. Now, here is where telehealth comes in. Telehealth offers a solution to this problem. It means that you can be sitting right here in Lagos and offering healthcare to a patient in Kenya, to a patient in the US, and they are paying you for it, right? This is a solution to the income problem for doctors. This is a solution to both impact and income problem. So for doctors, we are offering you a chance. Telehealth offers you a chance to increase your impact, to be able to deliver healthcare to certain people and certain centers that may not have gotten access to without telehealth. And it also increases your chance to get extra income and then make proper change, make good decisions, not just decisions based on increasing your income. Now, we know that there are limitations to healthcare. We know that there are limitations to healthcare delivery in Africa, telehealth generally, globally, and then especially in Africa here, you know that we will have several challenges, right? And so we are not ignorant of the fact that we have several challenges. For example, in this call right now, we've had so many breaking transmission because of the poor network situation in Nigeria right now with internet service providers. And so we understand that right on this call, we're already seeing some of the challenges. So as I go into challenges and how we are going to address them, nobody's a stranger to these challenges. Right now on this call, we've had network issues. I'm sure some people's network have gone off. Just like mine, I think mine is having a problem with the video streaming, and so my video is having a bit of an issue. We've had so many problems with internet in Nigeria and then in Africa generally. And so that's one of the major problems, the technical issue and adapting to technical challenges. Another issue is patient privacy and security concerns. And I know that's some of the issues that some people have had with telehealth, the privacy concerns, encrypting messages, both whether text or videos, ensuring patient confidentiality and integrity. The confidentiality and integrity of patient data is essential, and then building trust and confidence with telehealth services. That's one of the biggest issues that I know patients have had. Right, I know that's one of the biggest issues that patients have had with telemedicine, right? So we are still addressing that issue as a group, as a people. We're still addressing that issue. And then another issue, another big problem that a lot of people raise is the potential limits in diagnosis and treatment options. So for doctors and for healthcare providers, this is one of their biggest problems. They do not think that they might be able to deliver proper healthcare without seeing the patients. Now, that's some of the concerns that healthcare professionals have had over the years, especially for acute condition and complex conditions. A lot of doctors have been scared that telehealth might limit their ability to diagnose and offer good treatment options, and the quality of care delivery might drop. And so there are inherent limitations in this regard. And then there's also the next problem of integrating telehealth with our traditional healthcare practices. How do we integrate it? How do we make sure that patients who are already used to traditional methods will not have issues? So I am going to open the floor for us to share limitations that we can foresee in telehealth. And while I'm still handling the limitation, I'm going to tell you how I'm going to introduce a platform that is trying to solve some of this problem, and then offer you the benefits that we all spoke about, the benefits to the patients and to the doctors. But while we are still discussing the limitations, let's do this. If you've ever used the telemedicine platform, or if you've ever imagined using a telemedicine platform before, either as a provider or as a patient, what are the limitations that you foresee, or what are the limitations that you went through, but the limitations that you foresee?
Okay, I think the internet with Anita also got lost. Can you hear us, Anita?
Yes, I'm back.
You're back? Okay, cool.
Okay, so sorry for the break in transmission. It's just what I was talking about, limitations, right? Right. So while we're talking about the limitations, please just put in the chat the limitations that you foresee that we can experience in telehealth, or limitations that you've actually experienced while using telehealth, both as a provider or as a patient. You can just put in the chat so that we'll talk about it. All right. So one of the major problems is integrating with traditional health services. Another issue, another limitation that we foresee or patients have complained about is collaboration and coordination among healthcare providers, right? So a lot of people think that we might not be able to offer holistic care to patients when we use telehealth. Might not be that, that referral system that you have in a hospital, like in a traditional hospital where you can refer to an endocrinologist, for example. If you're if a diabetic patient, you want to refer to an endocrinologist, you have it right there in your tertiary hospital. You can just refer the person straight up and you have a doctor there, right? That's one of the challenges people foresee, and people have had experience with, I can't just refer the patient, as opposed to when I'm in my tertiary facility or in my secondary, I can just write a referral letter, the patient goes to see the professional right there. And so that's one of the challenges that people have raised with using telehealth, right? I'm going to just read the charts now and see, because I'm seeing that somebody has put in something. So I'm going to just read. I'm not abandoning you guys, so I'm still going to check your messages and I'm going to read up everything that you're saying. So just keep putting it in the chat. What challenges have you experienced? What limitations do you think you can experience? And we will handle that. But yes, that's one of the biggest challenges: privacy, collaboration with health professionals, of course, technical challenges. And now I want to introduce our solution to it, right? I'm going to introduce you to a platform, Wellness with Healthcare, and we're trying to solve some of the problems, right? Because we are seeing that it is necessary, but we are having a few challenges with adoption, right? And so we understand that, it is vital that we embrace technology in healthcare. But how do we embrace technology in healthcare without reducing the quality of care and still solving some of these limitations that we have raised? We know that we cannot eliminate these problems. We know we cannot completely eliminate these challenges, but we're trying to see, how do we solve some of these problems? How do we get the benefits of using telehealth while solving some of the limitations and some of the challenges? And that's where Wellness with comes in, right? That's where Wellness with Healthcare come in, right? So I am just going to reintroduce Dr. Kike Oduba. She spoke earlier, but most of us did not understand, we didn't get a proper introduction to who she was. So Dr. Kike Oduba is the founder and CEO of Wellness with Healthcare and Reinventing Healthcare Initiative. She's going to tell us the story of what bettered the need for Wellness with shortly, before we properly introduce you to Wellness with and what it provides. But the truth is, I want you to stay on the call, because Wellness with Healthcare, and I know I am biased by saying this, but Wellness with Healthcare solves a lot of the limitations that we spoke about and still offers you the benefits that we spoke about, both to the patients and to the practitioners, the doctors. So I want you to stay on the call while she talks, and then we'll introduce you to Wellness with. And just like I promised that at the beginning of the call, we have something both for providers and for users and for patients at the end of the call. So let's just welcome Dr. Kike Oduba to take over.
Thank you so much, Anita. Thank you, everyone, for being on this call again. As mentioned, I'm Dr. Kike Oduba. As many of you are also physicians and providers, you are in this profession simply because you care about people, you care about healthcare. However, I imagine that practicing medicine, and this is a global problem, not just in Nigeria or in Africa, practicing medicine comes with a lot of challenges, comes with a lot of burnout. And these days, it seems like medicine is no longer lucrative, for a lot of doctors. A lot of physicians are actually leaving the profession. Like I said, this is not only in Nigeria. I'm connected with the American Medical Association. I know the president, and one of the things that we found was that 1 out of 5 doctors in the United States are looking to exit the profession within the next 2 years. In the United Kingdom, as we know it right now, a lot of doctors are actually exiting the UK to go to Dubai or Canada just to go and do something different, or to practice medicine in another country. In Nigeria, for sure, I can tell you, I went to school in Nigeria, finished my medical degree. I can tell you that at least 70% of my colleagues whom we graduated together have already left the country to either go to the UK, Canada, or the United States. So the question is, who then takes care of patients when the doctors are leaving? That's number one. Number two is, how do we grow and innovate, in an environment where the people who we're innovating for no longer exists. And so I'm going to bring it down home to you, or to really help you understand why this is critical. So during the pandemic, well, actually, before the pandemic, I had a personal health issue, very serious. I was told that I needed surgery. However, I felt like, well, if I get this surgery, I don't think I'm gonna, have the same quality of life post surgery. And to put it in perspective, I actually had thyroid disease. I had a huge goiter in front of my neck, and as you can see, I didn't get a thyroid surgery, and I think I look well. I'm better than I did almost 10 years ago when I was ill. But what happened was I went online seeking answers, went on Google, went on Facebook, Quora, all of those forums. Like, what are the solutions to thyroid disease aside from surgery? Because the standard of care is you take out the thyroid and, give the patient drugs to continue to have thyroid hormone. Found this group on Facebook called the Hypothyroid Mom. There was over 1.2 million people on Facebook talking about their thyroid. Now, the problem with that is people are sharing private health information on a non-secure platform for healthcare. If you're familiar with what a HIPAA is Health Information Privacy Act. And so it's pretty much the way people are supposed to be protected when it relates to their healthcare. However, that doesn't exist on Facebook or on the internet. Cut the long story short, through lived experiences of people in that group, I was able to learn other ways to actually resolve my thyroid issues without getting that surgery. And I can tell you, 4 years in a row, I have been given a clear that I no longer have autoimmunity against my thyroid, and I didn't get the surgery, as you can see. Now, why I tell that story is because it led me to open up opportunities for patients to begin to interact with me online. So I started a thyroid recovery group. Within 3 days, over 30 women joined that group online. I was like, what's going on here? Like, folks would actually, join a random person who has, a story. They didn't even know that I was a doctor. Anyways, I decided I was going to start something online whereby I'm able to see women who have thyroid disease. So I opened this up for Nigeria as well. And guess what? People began to sign up all the way from Nigeria. The platform I was using back then, was like a coaching platform, and so it had its limitations. While that was going on, I began to charge money for this platform. For this group and actual one-on-one visits with myself. And what I found was, even in Nigeria, people were not afraid to pay me dollars to see them. But there is a limitation with that. Yes, people were paying money to see me for a consult. Maybe they'll pay about $30 to $40. We had a membership program where some people were paying $120 per month. In fact, it was more of continuous treatment and membership of every month, where they get specific attention from me. I'm able to write prescriptions and things like that. And so I thought to myself, how is it that patients in Nigeria are seeing me who is not in Nigeria, and they are willing to pay dollars? So that means there is a market for this thing. And my thought was, why are doctors in Nigeria not doing this? So I did a little bit more research, like, what currently exists for telemedicine in Nigeria? How are people practicing telemedicine? I realized unless your hospital is offering telemedicine, doctors are not likely to start a telemedicine practice. Unless, an HMO pays for the services, doctors are not necessarily going to get reimbursed or paid. However, there is this budding market, which, believe it or not, it's not only me. I know several colleagues who from Nigeria will set up a telehealth shop. Some people even did it on WhatsApp, where they just have a group of patients, and pretty much it was coaching. So I was doing functional medicine. If you know what functional medicine is, please drop a note in the chat. I want to know how many people are familiar with functional medicine. And the reason why I said that was, I am the very first functional medicine doctor to set up a practice in Nigeria. Literally, if you go into the Institute for Functional Medicine website, my name is listed there. If you look at all the different countries, for Nigeria, I was the only one listed as a functional medicine doctor available in Nigeria. I say all of that to say this. When folks were looking for a functional medicine doctor, They were coming directly to the IFM website, which is based in the United States. And I was the only one they could connect to. I had people on Instagram reaching out to me. They'll send me pictures of, Doc, I have X, Y, and Z going on. Can you please help me? So there is a need, there is a market. But why are doctors in Nigeria not tapping into this? Now, what made it even more, how would I put it, compelling for me was the fact that I had a patient, very influential family. If I mention the name, almost everybody on this call will know them. This patient had, what's it called? Lupus. She had systemic, she had SLE. And so when she came to me, she was already going to a hospital. But what happened was she began to have mental health issues connected to this SLE. What happened eventually was this patient died because the hospital she was going were not collaborating with me as a provider she's talking to in the United States. So I kept wondering, number one, why are they not answering my emails to ask for prescription? Like, what prescription are we giving this girl? This girl needs to be in the hospital. In fact, the girl literally refused to eat, refused to use any drug she was given. And so I needed her in her hospital because I know telemedicine was not enough. So I say that point because I want you to realize that even if you decide to do telemedicine, it doesn't solve all the healthcare problems. It doesn't completely take away, the need and the ability for patients to actually go in person to be administered, maybe IV or giving specific, treatment in the clinic. But what I'm trying to say is that with its limitations, telemedicine has a lot of opportunities for doctors to do more without doing too much, in the sense that they're having to, have an appointment wait list or even travel to go and see patients. So with that being said, we decided to create a platform called Wellness Suite where doctors can connect with patients, not just one-on-one, but also in groups. That means you can actually curate your list of patients. You can have, say, 30 to 40 patients with one single diagnosis and literally have them connect with you on a regular basis. So that's why continuity of care is so important, like Anita mentioned. How can you have a dedicated bunch of people who trust you as a doctor, who know you as their personal doctor, and continue to see you and adhere to care plans as you're giving to them? What you find is that most likely these patients actually don't mind paying you out of pocket, because the current landscape that exists, they still don't have the healthcare they need. Patients still feel like it's hard to see a doctor. Okay, after I see my doctor, how can I ask questions? How can I, get a prescription refill? Do I always have to be on a wait list for an appointment? Do I always have to pay every single time I talk to my doctor? And when I get in front of a doctor, I get barely 10 to 15 minutes. So to solve all of those problems, we've created a very unique mode of care delivery process where doctors group their patients and are able to see them in groups. On top of that, doctors are able to actually see their patients one-on-one. For example, like I told you, 1.2 million members in one single group on Facebook, delivering information, sometimes even misinformation that is not medically correct, because it's a social platform. However, the limitation is because doctors are not in the forefront of technology or innovation as it relates to telehealth. Better believe it. Facebook is fast becoming a telehealth platform. Instagram has become a platform that doctors are now using to market themselves. WhatsApp, a lot of doctors now, from what I understand, now have WhatsApp groups for their patients. And even better, WhatsApp has created a feature called community, whereby doctors can literally be posting things relating to health to a community of patients. So what I would like to encourage you to do is open up your mind and begin to think of ways that you can be innovative and start using telehealth on your own, without having a hospital, bring the resources to you, without having an HMO necessarily saying, hey, we're going to pay for these services. See how you can go direct to consumers and begin to deliver care to them. So with that being said, I'm going to hand it back to Anita to tell you more about the Wellness Suite platform and how you can begin attempting or trying telehealth on your own.
All right. Thank you so much, Dr. Kike. That was beautiful. Thank you so much. She said so many important things. But most striking of all was the story about the community on Facebook. And so we even now, if you go on Facebook right now and you type in, say, groups for nursing mothers or pregnant women, you will see so many groups. If you go and type for diabetes, for example, you're going to see so many groups on Facebook. But we cannot control the type of information that is being shared on these groups. We cannot control the type of information and what they get, which is why a lot of doctors, if you've ever practiced in Nigeria, you know those patients that have come to you. I've had patients come to me and say, hey, I stopped my medication. And I say, why? They say, because we're in this group and they said we should not take the medication. We're in this group and they said we should use this herbal medicine. And that's what I'm using now. And I've had a diabetic patient die because she stopped using his medication. And he told me why he stopped. And no matter what I said, I couldn't convince him that she get back on the medication, because he said on the group they had told him not to use that medication anymore. That doctors were just stealing his money. And so, and they were paying for this other medicine. That was the funny thing. They were paying heavily for this other medicine that I think was something from China or something. And they were paying very heavy. And I was like, the medicine you were using before was cheaper. So sometimes it wasn't even about cost. It wasn't even about the cost of service. It was just that there was a community of people that listened to them. And so they felt more welcome. They felt more listened to, because they felt like these guys heard me out. It wasn't just a 10 minutes conversation in the hospital and you gave me drugs and I don't feel like I have a relationship. I don't feel like you actually listen to me. And so what we're trying to address is that community that exists in, say, Facebook and all of these platforms that these guys are using, right? So we want to build a community of people where the doctors are reachable. For example, doctors are reachable, and also where you can create programs that solve problems for these people. So it addresses the problems that we are having. So with Wellness Suite, you can develop personalized health plans for patients. And that's so wonderful, because this is what patients are looking for, really. They're looking for attention. They're looking for your attention. They want to know that you actually do care. And for the healthcare providers, I know you are hearing all of this and you're like, oh, well, you're solving the problem for patients. What do I get? Right? Okay, you want to solve all these problems for patients. You want to make me reachable 24/7. You want to make me develop health plans for them. You want proper records, because that's another thing with Nigeria. And I know a lot of Nigerians, we are phasing out of paper, which is hallelujah. We're phasing out of paper health records. We're all moving to electronic, but I know some people are still with electronic health records, and all the problem that brings. We all know the problem of electronic health records, where we lose patient records. We can't keep track of medications that they are on. And so Wellness Suite is solving all of this problem. With Wellness Suite, you have health records that are safe, and you can transfer at any time, right? You have telemedicine calls. Patient comes to speak to you. So I'm still dealing with what it benefits the patient. I'm going to come with how it benefits the doctors. And so you have educational content. As a doctor, you can develop educational content that patients can go through and benefit from. So if you're a rheumatologist, for example, or you're an endocrinologist, you're a nutritionist, and it's not just for doctors. That's why I'm always insisting healthcare providers. I'm using healthcare providers as opposed to just saying doctors, because our platform is not just taking in doctors. We are doing holistic healthcare. So everybody in this healthcare field is welcome. We are all playing together, which is why it's beautiful. A lot of people, we are not isolating nurse practitioners. We're not isolating nutritionists. If you're involved in the healthcare delivery, we are welcoming everybody, because we understand that all these professionals are important for holistic care, for the wholeness and wellness of individuals. We are taking in everybody. So you can develop a nutritional plan as a nutritionist. You can develop mental health support as a psychologist, as a psychiatrist. We are the platform for you, because you can develop plans for your patients. Basically, we are helping you build a practice without the infrastructure that you would have needed. That's the truth. We are helping you set up a full hospital without a building. We're helping you build a hospital without a physical building. That's what Wellness Suite wants to help you do as a healthcare professional. We are giving you room to build a full hospital without a building, without having the problem, because we understand what it takes to actually start a practice in Nigeria. We know what it is to build a practice in Nigeria. And we are saying, hey, let's help you do this without you having to set up a building, a physical building. We will handle digital records for you. We'll set up the infrastructure. I saw in the chat when I asked for limitation, which is beautiful. Somebody said he actually tried setting up telemedicine practice, but he had a problem with privacy and a lot of patients being worried about the privacy of their information. Now, the good thing is Wellness Suite is HIPAA compliant. So we take the privacy of our patients data very seriously. The fact that we're registered in the US, you know how US is serious with patient data. Nigeria cannot be more serious than the US about patient data. The US is very, with data generally, the US is trying to clamp down on data security. And so we are compliant with the same principles. We are serious about securing patient data. So we're not selling your patient data to anybody. There is no release of your patient data. And so we are helping you handle that problem that you just raised about security of patient data. So now you can tell the patients that you're onboarding that, oh, your data is safe because this company that we're using is HIPAA compliant, right? You can assure them that, oh, your data is safe, you won't have any problem. So you see that we are helping solve some of the challenges that you already raised, right? We're helping you solve some of those challenges, right, by onboarding on our platform. And then let's talk about the income, which is what a lot of people are waiting to hear, really. How do I make money? Where's the money part? Like, I know a lot of healthcare professionals right now, like, I've heard you. Now, how do I make money? How am I going to benefit from this? Now, with Wellness Suite, you stand the chance of, I don't even want to say ×2 of your income, because I understand, like, basically you work, you get as much as you work for, which is what a lot of people want. Like, if I'm putting in the work, I should see the reward, right? If I'm consulting, if I'm seeing patients, which is a lot of issue that which is what's causing a lot of the migration issues we're having in Nigeria. Most people are feeling like, I'm not getting remunerations that correlate with the amount of effort I'm putting in. So I'm doing the work and I'm not seeing the money. So that's one of the issues we're trying to solve, right? So that you don't have to leave. There are patients in Nigeria that want healthcare, right, and are ready to pay you. And so we want to bring you together with those patients who are ready to pay you, right? So we're helping you set up your practice online, and then we are paying you for every consultation that you do. And when you set up your practice properly and you're able to set up programs and care plans, those patients are paying you to access that information. So we are saying, if you set up a care plan, you set up a group, you provide all the necessary information, and patients buy these care plans, they will pay you for it. We are not saying you're not doing all of this for free. All these care plans that we just mentioned, when you create them, patients are paying you to access this information. So just like the way they would have gone on Facebook and joined a group and they are paying doctors on Facebook and they are paying professionals on Facebook to get consultation and to get access to plans, it's the same thing we're doing. I've seen nutritionists sell meal plans on Facebook before. I've seen nutritionists sell meal plans on WhatsApp. They create WhatsApp group and say everybody pay 10,000 to access, and people pay. Thousands of people join these platforms. So now we're saying, in a secure and more organized way, we want to help you sell your plans. We want to help you sell these plans that you have curated. And so when you put it on the platform, the chances of the opportunity for income is unlimited. It means that 1,000 people can join your care group, 1,000 people can get your plan, and you get paid for those 1,000 people. That's the long and short of it. Of course, we're going to get a percentage for running the system for you, but you are getting a bulk of your income yourself, right? You are getting paid for what you're providing, and because it's already a plan that exists, you are not providing. It's not repetitive work. So you can imagine that you've already done the work. You do the work once, and you are making money from it over and over and over and over again for something that you worked on once, and maybe you go there and you come and you do a few work, but it's something you've already done and you're making money from it over and over again. So we are opening up a chance. We're going to show you a brief demo of how it works. But before we do that, just like we took challenges, and I saw privacy and I saw technological challenges, again, I'm still going to take feedback from you. Like, now that you've heard what Wellness Suite is offering you, now that you heard what we are able to offer you, we are able to build the infrastructure for your telehealth practice. Because I know a lot of people that want to do it. I also wanted to start a telehealth practice at the beginning of because you can see the opportunities, right? You can see the problems. You can see, oh, there are lots of people seeking healthcare, but you don't know how to reach them. I know a lot of my friends who tried WhatsApp, who tried some of this, but because of some of the challenges with it, they had to stop, right? So now that you found the solution to these challenges, what do you actually think? What's your feedback? What do you actually think about Wellness Suite? What do you think Wellness Suite can offer you? What do you want us to offer you, for example? So you're going to share with us what you want us to offer you. You're going to tell us again what you think is unique that we are offering that you are excited about, right? So I'm going to take those answers. You can put on your video. You can just raise your hands up and I'll call on you, and then you can speak up. If you are not comfortable with that, you can drop it in the chat. Either way is fine with us. You can unmute yourself and talk. And then, but before then, we're going to take you through the app. I'm going to welcome Odun while I just round up. Odun is going to show you how the platform is. You're going to go through a demo of the app and see how it is, see how wonderful, because the app is beautiful, even if I do say so myself. It's a wonderful app. It's a beautiful app. You would love it. Patients are going to be excited about it. It's already well structured. It's well structured for you to enjoy. So we're going to show you a demo of that app very soon. But I just want to assure you that this is a wonderful opportunity. We set up this webinar to get you interested in telehealth generally, but we're also telling you that there's a solution that we have provided. But basically, we're doing this webinar to tell you, there's opportunity for increased income, even if it's not Wellness Suite. We're saying there's a market for this thing, right? There's a market for this thing. We need to innovate in healthcare in Africa. We need to change how we're doing healthcare. Traditional way have worked for a certain period, but right now we need to adapt. We need to change. The world is fast moving, and we need to solve problems, right? We're not just doing it because we need to use technology. We're doing it because problems exist and we're trying to fix it, right? We do not have as much healthcare in remote areas. We all know the statistics, right? We do not have as much healthcare in remote areas, and these people have started using smartphones, right? So we've had a 40% increase in the uptake of people using smartphones in the last 5 years. What are we doing to help those guys? So now they have smartphones, right? But they can't get the same healthcare services people are getting in the urban centers because, and I'm particular about this because I've always thought like accessibility has always been a problem that I've always thought we needed to solve. And so telehealth is a big solution to the problem of accessibility. And so I want us to think of innovation. I want us to think of being open to change. I know we will think, oh, how do I deliver healthcare? The challenges of quality of care. I know somebody also mentioned that as a challenge in the chat, that you feel like the quality of care will not be the same. And it's true, in-person consultations will never go out of fashion, right? There will still be a need for in-person consultation. But right now, there are a lot of solutions there are a lot of avoidable deaths that we could have solved if this patient spoke to a doctor. In some of these places, you have people talking to chemists that are not professionals at all. You have them people who are not even pharmacists, who are not trained pharmacists, but just have a shop, a drugstore. And you have patients going to pay them to access healthcare because guess what? Just those are the people that are available. Those are the people that are close to them, right? And so we're saying, let's bridge the gap. Let's make it work. And so, although if you're ready, just let me know. If you're ready for the demo, just let me know. We want to show you how the app works. We want to show you how Wellness Suite app works and what the patients are going to see when they come onto Wellness Suite. We want to show you how it works and how much is available for them so that you see the solution that we're building and how wonderful it is. Or do let me know when you're available, right? And so we are solving a problem and we want you to be part of the team. We want you to be part of the team. I say it again because I know how money is important to us. And I'm saying this is an opportunity for you to, I don't want to say 10 times because I know it's going to be like over-promising and under-delivering or something like that. But you can 10 times your income if you're actually quite serious. You can 10 times your income, you come on the platform and you are ready to work and you're ready to create plans and actually show your expertise. This is open to everybody. And so even people who are not on this call, we were going to share a link with you where you can fill in your details. Feel free to copy the link. Feel free to copy the link and share with your with other health service providers that you know. Feel free to copy it and share with them. We are still going to onboard properly, which is one of the opportunities, like I said, at the end of the call. So for everybody that is actually on this call, we are going to give you a free chance to open like your plan, to build your practice on our platform for free. We're not charging you anything. We're not taking anything from you to do that. And so we're giving you an opportunity for every health practitioner on this call which is wonderful because we are saving you a lot of money because we charge for this. So we are saying just because you are on the call today, we're giving you an opportunity if you fill the form, which we are going to put in the chat for you to see. If you fill the form, you get an opportunity to start up your practice, to set up your practice on our platform for free. We're not going to charge you anything. And usually we charge patients all over the world, even in the US, we charge them for them to do this. We are giving it to you for free, just because you took out your time today, in appreciation for you taking out your time today to join this call. We're giving you this opportunity for free. Madhu, let me know when you're ready. I'm still waiting for you. All right. So we're giving you this opportunity.
Yeah, while we wait for
all right, so the form is already there. Form is already on the chat, so you can start to fill that.
Can you hear me, Anita?
Yes, I can.
Okay, while we wait for Dawn, I just want to say a little bit more about the platform. So what this helps you do is to try out how to start your own telehealth practice. Everybody gets a basic account whereby you can add your qualification, you can begin building care plans, you can add services, things like, oh, I want to do just a health assessment, or I want to do nutrition coaching, or I just want to manage people with diabetes. All of those good things you can actually start. You can even put up articles. You can link your Instagram, your Facebook, or if you have a website, go ahead and set all of that up and just try and see how it works. The reason why we're doing this is we want to get your feet wet and give you the motivation to actually see what's possible. And then afterwards, what we will do is we will continuously engage with you. We would even run calls where we can onboard you on a call and say, hey, where are the bottlenecks? Where are you having challenges? What questions? So it's a white glove service we're offering you for free. Like Anita said, this is something that we charge hospitals, we charge doctors to get access to. Of course, our business is mostly in the United States, and that's where we're growing. But personally, I just have a very strong passion for opening up healthcare in Nigeria or Africa or in underserved areas, because I also have family in Nigeria who cannot access this care. And so we want to give doctors tools and opportunities to actually compete on a global scale. How can you begin to publicize yourself as a doctor who offers telehealth, and how can patients reach you? How can they access you? So that's the thought behind us doing this exercise. So we want you to submit your information in the form that was sent. And the reason that form is structured the way it is for us to be able to send you your account information. So look forward to getting like an email. Check your spam over the next 1 to 2 days, whereby you're going to get an invitation to join the Wellness Week platform. You're going to get a unique link, and that link is very specific to you. So please do not share with anyone else. Like we mentioned, it's only the people on this call we're offering this. This opportunity comes only once in every 3 months. So the next time we're going to do this and open up this opportunity is going to be in the end of June. We're doing this quarter by quarter. By the time we reach a specific number, we're no longer going to be giving out free accounts, just so you know that. So if you have friends who are interested in joining, feel free to copy this link and share it with them. You're free to share that link. But after this month, so today is the 16th of March, we're only enrolling over the next 2 weeks for this period. And only on these webinars, these links are going to go out. So I say that because I know that people might, not take action now and think later they can get access to it. In the next 3 months, you'll be surprised. 5-10 people on this call will start making money. They'll start seeing patients and their practices will grow while you're still waiting till another quarter to get in. So jump in now if you really want to access this. And then in 3 months, we're going to put up another webinar where people can enroll into the platform. Afterwards, there are other opportunities to engage with us, but not at this level that we're offering you right now. So I'll let Odun take over and do the demo.
Okay. Good day, everyone. Thank you so much, Dr. Kike and Dr. Anita, for everything. So we'll be moving on to the demo for the application. So like Dr. Kike has mentioned, please feel free to drop in your details in that form, and immediately we'll be sending a follow-up as regards that. So I'll be starting with playing a demo of the provider application. So you get to see tools and the resources that you can actually use to start your telehealth practice. Okay, sorry. Please, can we confirm if you can see my screen?
Yes, we can.
Okay. Could you hear it?
Yes, we can hear you.
Okay. Can you hear the video?
Oh, no, we cannot hear the video.
Okay. I'll be walking you through the wellness. Hello, good day. Welcome. Can I confirm if you hear the video?
Yes, we can hear you. We can hear the video now.
Okay, great. Thank you so much. Hello, good day. Welcome to Wellness Suites. I'll be walking you through the Wellness Suites provider and clinician platform. Let's begin. Type in your username and password. Once you've successfully done this, click on the sign in button. You're welcome, and the first screen you see as a successful login is your dashboard. You're able to see your booking requests over here, total clients added, total numbers of care plans, and total numbers of groups. This top model here serves as your daily updates and informatics. Now, moving on to the left-hand side, you are able to see upcoming session, which details your program sessions and also group sessions which are to happen. And then we have details and updates up here on the left-hand side, which serve as reminders and tags to keep you informed and up to date on your daily projects. Moving on to the right-hand side, we have a screen that displays the total member count, which allows for you to know as a provider the total members you have within your practice and also the new members that you have within your practice. Next, we have programs. Programs are well-curated health and wellness activities made by you and created by you for your clients to reach their various health and wellness goals. And lastly, we have groups, which centers and focuses on shared experiences. Here, you're able to efficiently run your practice by bringing together a myriad of clients who have shared experiences to collectively learn from you at once. And the beauty about this is that it doesn't only reduce your burnout and increase efficiency on your path, but it also provides a form of solace and sense of community for your members. They understand that they do not have to isolate themselves by going through their health and wellness goals, and through this, they can reach and attain holistic and wholesome wellness. In this demo, we'll be focusing on creating care plans, programs, and groups. Let's start with care. What's care plan is a document that outlines a client's health and social care needs and how they are to be supported. To create a care plan, first you need to click on the Add Care Plan button. You input your care plan title, your description, your start date, and duration, and you click on Save. Immediately that you have clicked on this, your care plan is created here, and all you have to do is click on Edit Care Plan. For this, we're working on the Wellness Care Plan, and we'll click on Edit. Here, you're going to be able to edit the name of the care plan. You can add goals within your care plan. You can add programs within your care plans. You can add medications, supplements, meal plan, fitness plan, affirmation, forms and waivers, members, groups, and files. Once you're sure of everything you've imputed on here, please click on the Save button to commit the changes you have made. Next, I'll be walking you through on how to create groups. Click on the Groups button here to begin. In Wellness Suites, groups refer to communities or forums where users with shared health and wellness interests or experiences can come together to connect, share insights, and support each other. These groups can be focused on specific topics, conditions, or goals, providing a platform for users to discuss, learn, and build a sense of community. It is a feature designed to enhance the social aspect of the platform and foster a supportive environment amongst users who may be facing similar health or wellness challenges or pursuing common objectives. To begin, please click on the Create New Group button. Once you have clicked on that, you are to input your group name, your group type, description, and add your members. Please do not also forget to add a thumbnail to the group. Once you're done, click on the Create button. Once you clicked on the Create Group button, your newly created group will be populated and added on here. To add more details in your group, please click on the View icon. Here you'll be taken into the group you just freshly created. You're able to see member insights, total visits, and engagements. You also have the ability to create posts as a provider and to get your clients and members engaging within the group. And lastly, I'll be walking you through on how to create programs. Let's begin. To create a program, navigate to the sidebar and click on Programs. What are programs? In Wellness Suites, programs are specialized wellness initiatives or courses designed to address specific health concerns or goals. These programs provide users with structured guidance and resources to support their wellness journey. Each program is tailored to address a particular aspect of health that may include personalized coaching, educational materials, workout routines, nutrition guidance, and more. To successfully create a program, click on the Add Program button over here. Click on Create New Program. These are all the steps required to successfully create a program. First thing you want to do is add a thumbnail to your program, add program title, add a description, select program type, program start date, program end date, add members, add your care team to this program and click on the Save and Continue button. The next thing you want to do is move on to models. To create a model, click on the Add New Model button. You're going to attach a thumbnail of this model, the module title, the description, module content, and if you have any files you'd like to upload to this model, please do that by the addition icon right here. Once you have done filling in all this information, you can successfully click on the Add Module button. Next, after clicking on Save and Continue, is to add sessions within this program. To begin, please click here to add a new session. Add in your session title, the description, the date of the session, and select a duration for your session. After successful session creation, the next thing to do is to add a forum. Here you're able to engage with your clients and members within this program to hear their thoughts and opinions about certain things. To begin, click on the Start a New Topic button and simply write something. Once you write something, you post this and this is active and visible on your client and member wall. The last thing to do in successful program creation is to add members. Click on the Add New Member button to begin. Input email address of member and also input name of member. Once you have done this, you can send invitation to your member and they are successfully added to the program. Click on Send Invitation. Your invite has been sent successfully. After going through all these 5 steps, please click on the Finish button to commit all the changes you have made. With this, you have successfully created a program. We hope this tutorial was helpful with getting you onboarded and getting you well versed with the Wellness Suites clinician and provider platform. We hope to have you on our platform very soon and looking forward to connecting with you. Empower together, journey strong. Thank you once again from team of Wellness Suites.
All right, thank you so much, Odun, for that video. Thank you for that demo. So we've seen how it looks like I know it's a bit, don't be scared if you're a bit confused. We're going to do a call. So if you check the form that you just filled, I'm sure you selected the time that best works for you, because we understand that most people cannot be available at all times. So we curated times for you for onboarding calls. And so it's right on that form. So you just select the dates that work for you so that we'll onboard you properly. Like Dr. Tike said earlier, we are opening this up just for a short while. So please make sure you do it as soon as possible. Select a date. We will get to you on that very date, get on a call with you and properly onboard you. It won't take your time. In 30 minutes, we'll be done. We'll properly onboard you and get you through the system. So that video you just watched, that demo you just watched, is exactly what we will do for you. So it's nothing complicated, but we just want to take you through it step by step and help you do it so that you don't have any issues. So we are here for you. We want to serve you better, and we want to help you experience this, have the best experience. So we will set you up properly on these calls. So select a date in the form. I'm still taking feedback, so you can unmute yourself or put it on the chat. Exactly what excites you the most about what we're offering you in Wellness Week. What excites you the most, and then what do you hope to see? What do you hope to get when you get on the platform? What do you want to see on the platform? What do you hope to get on the platform? Right? You can put it in the chat. You can put your hands up, and then I'll give you an opportunity to talk. But generally, you can share that link for the next 2 weeks. Like you can see the dates that are available are dates for the next 2 weeks. So you can share that link for people to join and select an onboarding date. But after 2 weeks, that link might not work again. So please share that link right now. You can share it to your friends that are healthcare providers. Share that link to them. Let them fill the form, and then we will onboard them in the next 2 weeks. So please share that link to any other healthcare provider group that you're on. If you're in a group with doctors, you can share that link to them so that we can onboard them in the next 2 weeks. After the next 2 weeks, you're going to close it for this cohort. So share that link and let them know that, but let them know that it's a limited period. It's just for a limited time. We're going to close that link for as soon as those 2 weeks allow. Thank you all for joining. Again, you can share your feedback with us. Okay, I'm seeing some messages in the chat. All right, so just keep sharing. You can share your message in the chat. You can just let us know in the chat.
Yeah, let's also give room for people who want to speak. Does anybody have a question or contribution? Actually, if you want to share your experience, please let us know. Feel free to unmute your mic and talk to us on the call right now. For those of you who have thoughts, questions, or feedback on telehealth. Any takers? Everyone seems quiet, but it's been interesting. Most of you stayed on, so thank you for holding on and listening to the webinar. I think there's a chat message in the.
Okay, somebody said, how can doctors contribute? Well, this is how you can contribute. You join the link, like fill the link, and then we'll get to you, right? So you're welcome. It's for you, right? The platform is for you as a doctor. To answer that question, you can contribute by rendering your services on the platform, and you're going to get paid too. So that's how you're contributing. You're setting up yourself on the platform. So just fill in the link, put your details. We'll send you more messages, and then we will also, if you select a date, we'll get on a call with you on that date to onboard you properly as a doctor. So as a doctor, this is for you. This event is for you. So we wanted to get you interested in telehealth, to see the benefits of telehealth, to see the opportunities that exist in telehealth, and then to get you right. So we are here for you. You are the reason why we organized this webinar.
Yeah, and aside from doctors as well, if you're a healthcare professional, whether you're a dietitian, you're a nurse, physical therapist, whatever it is you are, go ahead and fill the form. And you'd get, if you don't have a license, right, just note there that you do not have a license, and we will reach out to you to help you understand how you can practice, using Wellness Suite's platform. Because we do have health coaches on the platform as well who help doctors and who support doctors, with, behavioral change, following up with patients and things like that. So you can definitely be on the platform if you're not a doctor. I just wanted to mention that. And if you're not a provider, you're just a curious member of society who wants to make a change in healthcare, we also have opportunities for you to engage, and I'll share that with you, in a moment. But the whole point is we're trying to create a community of people in Nigeria or any other country, really. You might not be in Nigeria, but wherever you are from. In fact, we actually have a Cameroonian doctor on the platform recently joined. And so whatever, or wherever you practice, we want to open up opportunity for you to begin putting yourself out there and practicing telehealth with very little to no barriers, right? This is, like I said, 100% free for you right now. Over time, we're going to close this program. We're not going to do it for too long. We're just trying to grow the community. And after a while, the barrier to join is going to be much higher later. That's why I truly encourage you all to take a leap now. Now, if you're not a doctor, you're not a provider, and you're just a community member who wants to just learn about how to be in telehealth, we actually have a Technovate program. And that program pretty much is to help people who are not healthcare providers, but they want to innovate in healthcare. So reach out to us. Our email is info@rhainitiative.com, and let us know your interest in, contributing to digital health or telemedicine. We will reach back out to you. The whole reason why we're doing that is because, better believe it, most of the people on our team are not healthcare providers, but they put together, except for me and Anita, everybody else did not go to school for medicine, but we're innovating in healthcare. How can you contribute as a tester for patients, journey maps? How can you contribute by being, what's it called now? Somebody to actually help the doctors practice, their telemedicine, where you do user acceptance testing. How can you be a UI UX designer, or how can you be a healthcare communication specialist? Those are things that we're willing to train you on. One other thing that we didn't mention is artificial intelligence. We are actually partnered with IBM. If you're familiar with IBM, it's a global tech company, and they have given us AI capabilities to help doctors do their jobs much easily. And so on the patient app, which, Anita, is there any plans to show the patient app, or I should go ahead and do a quick show of the app so that people can see what their patients actually interact
Yes, you can
with?
go ahead, Dr. Kike.
Okay, so we have an AI capability on the patient app that allows patients to automatically get help, without the doctor being there. So don't be afraid that if you're doing telehealth, you have to be there 24/7 attending to patients. That's what AI does for you. And Wellness Suite has already incorporated that. And so I'm going to briefly show you what the app looks like on the patient side. We typically don't do this demo in provider meetings simply because, doctors might not use the mobile app that the patients are seeing, but feel free to download it. Just go to the app stores and download Wellness Suite, and you find, the patient app. And if you have family members who have health problems, I think I need to get host rights, Anita and Audrey. I'm not able to share my screen. And so, like I was saying,
we have an app then, was just a video.
Oh, you have an app demo?
Yeah.
Oh, then go ahead if you want to do that, and I'm happy to share my screen, whichever way works best.
Okay. The app demo is just it's less than a minute, so we could just quickly look at it.
Sure.
Awesome.
Yeah, let's do that. Okay, while we wait for the demo to come up, I'm just going to keep yapping to keep us engaged. So So yeah, so there's just something for everyone. The whole idea is to reinvent healthcare in Africa, and it's not only doctors who are going to reinvent healthcare. We want, people who can code. We want people who can. Oh, go ahead. Let me pause now while we see the app demo. Amazing. So that's what the app looks like. And like I said earlier, feel free to go on the app stores and download the Wellness Suite app. Share with your family members. There's programs on there already. We have the Diabetes IQ program. We have a breast cancer recovery and management program. We do have a COVID-19 for people who have long COVID, which is more common, in most Western countries. I don't know if Nigeria, has that problem. We also have programs for kids from 0 to 2 years old. We have programs for several things. And so feel free to join the platform and share with your family members. And like I said, as a provider, the link that was shared previously is how you get enrolled. If you go on our website, you will not see that link. So don't think this is something that will always be there. I reiterate that because we're not going to attend to people who are trying to join the platform after what's the date for the last onboarding call, Anita? I think the 25th or the 28th of March. So I think on the 20, perfect, the 29th. Right. So 2 weeks from now, we're going to stop onboarding doctors because there's a white glove service. It's pretty much hands-on. And so we're not going to be able to handle too many people at once. So I really implore you, go ahead and register. I don't like us to make promises to the people who register and then we're not able to fulfill that. So I want us to really focus on the people who do register. So I guess that's it. Is anything else, Anita and Ojo? What else do we want to address? I know we're almost at time. I want to be respectful of everybody's time. It's a Saturday, so
All right, yeah, so that's about it. Follow us on social media. So we'll post our social media handles just for more updates and more information. So like Dr. Hike said, we're serving both people interested in digital health and then healthcare providers. So even if you're just interested, if you're tech inclined, whatever it is, follow our social media handles. We'll be sharing more information over the next few weeks. You get more updates, more information. So everything that we could not discuss on the call, and then everything we try to tell you in the short space of time, you can get more information about it on our social media handles. We'll keep sharing more information. So please follow us on all our social media handles so that we can so you can see that they're already in the chat. So you can follow those handles. Make sure you follow us on social media and interact with us. We'll be posting more opportunities and then more events. When events come up, you get access to it, because we're planning to run much more events this year. So look out for us. We'll have more events this year, but webinars, physical events in Nigeria. So just look out for us, look out for our posts. We'll let you know when the time comes. So that's why I want you to follow the page so that as soon as we have an event, you'll be the first to know. So that's about it for today. If you have any questions, even if they come up later, you can send those questions to those social media handles and then we'll get back to you. So even if you can't, you don't have the questions right now, if you think of something else in a few hours, just send it to those social media handles. We'll get back to you, definitely. thank you all for taking your time today to join this call. We appreciate you. Thank you for filling the forms. We know some of you are already filled, so thank you so much. We appreciate you joining the call today. Like we said, you can share that link with your friends that are healthcare providers, but tell them that we are onboarding in 2 weeks. And so after then will not take. So if they're going to fill the form, they should do it within the next 2 weeks. Thank you all again. Thank you for taking your time. It was so wonderful to have this conversation with you. Thank you for taking time out of your busy Saturday to spend with us. We're excited that we get to work with you. Thank you all so much. Have a wonderful weekend.
Thanks, y'all. Bye. Bye, everyone.
Bye, everyone.
Bye. Team, please stay on the call. Odun and Ayo and Jide and Anita. Let's stay on the call while we let our guests out. All right. It's just us now. Do you want to stop recording?
Okay, yeah, so